Hello, and welcome to another Joe and Kat Chats. Woo! We're both excited. Joe, what
Yes,
is
ma'am.
written on your mask?
On the mask today, on the mask, it says here, stop killing black people, defund the police. Stop killing black people, defund the police. Okay? The
Yes.
epidemic, there's a pandemic right now, it's COVID-19, the coronavirus, but the epidemic that is taking place in the United States is the systematic genocide of black people being hunted down and killed by white police officers. We've
Yeah.
seen George Floyd, we've seen Ahmaud Arbery. In years past, we've seen Eric Garner, we've seen Freddie Gray, we've seen Laquan McDonald, we've seen Tamir Rice, we've seen Jacob Floyd.
Yeah.
Okay, this shit must stop. So
Yeah.
police officers, stop killing black people. Defund the police. Defund the police. Put that money into community resources that will actually benefit the community. Have community policing. Do the right damn thing. So stop killing black people. Defund the police. We're going to start off with that today because that's the tone we're looking to set, Miss Wells. That's the tone we're looking to
Yes.
set. Okay, now I can hear a little bit better. I can enunciate my words with intonation, phonation, accuracy, and pitch. Earlier on today, again, this is the day after Election Day, November 4, 2020. The day after the election is still hangs in the balance. We're still up in the air, so to speak, about the election. I attended a Count Every Vote march in Durham, North Carolina. Okay, workers demand. There's a bunch of workers there that are fighting for $15 an hour minimum wage. Personally, I think $15 an hour is a low amount of money for a minimum wage. It really needs to be more of like $24, $25, or $27 given worker production since the minimum wage was first established, I think in the late 60s or early 70s. But regardless of that, make sure every vote counts. Count every vote. We've talked about this in our voting episode of episode 20 of the historic and legendary Joe and Kat Chat series. We discussed the amendments that take place that are necessary to ensure voting rights for every American. We discussed the 15th Amendment, which provided black people the right to vote. We discussed the 19th Amendment, which provided women's suffrage. And that amendment was ratified 100 years ago. We talked about the 23rd Amendment, which gave the United States citizens in the District of Columbia, the capital of the United States, Washington, D.C., the right to vote. And we talked about the 26th Amendment, which gave 18 years old or older residents and citizens of the United States of America to vote. So once again, it's already too late to vote. To borrow a phrase, I forget what novel it's from. The die has been cast. I think it was Homer that once said that. The die is cast. So the votes have been cast. So we're counting votes. So count every vote. Unfortunately, I live in a country in the United States that has forgotten how to count.
Yeah.
We don't know how to count paper ballots. And 50 states have all sorts of different rules with regards to counting votes. But be that as it may, we're going to make sure every vote gets counted. We're going to make sure every I gets dotted. We're going to make sure every T gets crossed to make sure that every vote gets counted. Because
Absolutely.
Our vote is our voice. Our voices must be heard. Our voices will be heard. And in the words of Public Enemy had an album years ago. The name of the album was called "It Takes a Nation of Millions to Hold Us Back." Okay? Our votes will not be held back. Our votes will not be held back, nor will our voices. So again, we're going to make sure that all of these swing states, and all of these states that might get flipped from red to blue or blue to red, and people are talking about court cases and taking it to the Supreme Court, count every vote.
Yeah.
Count every vote.
Absolutely. Yeah, we're all sort of waiting for the results, and I think that they need to take as much time as they need because every vote counts. And you're so right. I really hope that, this movement works and they do count every vote, because there has been a history of not doing that in your country.
There has been a big history of that. We saw in the 2000 election 20 years ago that it took about a month to resolve the presidential situation in Florida. And then Al Gore won the popular vote, but because of the Electoral College, George Bush ended up winning the vote.
Yeah.
But we don't want to get sidetracked. We want to look. You and I. This is the Joe and Kat Chat series. We're the type of brothers and sisters that like to stay on topic. We're on the straight and narrow. We like to keep the trains on time and the smoothies on time. So we're going to make sure that we stay focused and task-oriented today. Ms. Wells, please tell the viewing and listening public what our topic is today.
Oh my goodness. So today we're talking about healthcare, and we did do an episode already on healthcare, but this is the update. We're going to go through some of the basics again, just as a little reminder. But there's a lot more to talk about, and we're going to get into it. There's a lot of topical stuff that we're going to talk about as well that's coming up this November, and just in general. There's a lot to be said because healthcare is always the number one issue. Both at election time and just all around people need healthcare and people are not getting it, and it's a huge problem for nations like ours.
Absolutely.
Yeah.
And Ms. Wells, it something we like to do, and this is the 23rd episode of the Joe and Cat Chat series. It's something we like to do. I know it's time flies. Time flies when you're having fun, and we have certain habits that we like to uphold and certain traditions we like to upkeep. And one of the things we like to do is to have some definitions so we can set the tone for what the conversation is actually going to be about. Mm-hmm. And as you so eloquently said about 90 seconds ago, you said, you know what, this is the healthcare update. And healthcare, as we talked about in the first episode, is a compound word made up of health and care. So many of you all are probably doing yoga or watching us right now or listening to us, and you're saying, well, Joe, come on, man, what's health? What is health? And health is a condition of being in sound mind, body, and spirit. Okay? It's free from illness. So yeah, I'm healthy. I feel strong. I feel good about myself. My mental well-being is there. My spirit's right. My A1C count is low. My blood pressure is 110/70. My BMI is appropriate for my height and weight. My triglyceride count is low. I feel really good about myself. I'm in good health. I'm not depressed. I have a positive outlook and a positive attitude on life. That's good health. But what's care? Care is when someone is in charge or responsible for your well-being. So, hey, who's going to care for me? Who's going to pay attention to what I need? Who's going to be there for me in my darkest hour? Who's going to care for me? So that is care. Now, healthcare is when you have efforts to maintain or restore physical or emotional well-being by licensed professionals or people that actually know what the hell they're actually doing to make sure you, Miss Wells, or me, Joe Nice, is actually healthy. So I wouldn't go to an automobile mechanic to learn how to lose weight. That's not appropriate because they're not licensed to deal with weight loss. Nor would you go to a drywall contractor to figure out about certain types of women's health issues. It doesn't make sense because they don't do that. But you would go to a gynecologist because there are certain issues that women have with regards to health that they are professionally trained to deal with. And then if I have some issue, if I have a heart problem, I'm not going to go to a podiatrist. I go to a cardiologist because cardiologists deal with heart issues. So again, as I said earlier on in the 5th episode, which was, almost a little more than 4 months ago, healthcare is a compound word, but it is greater than the sum of the parts that make up that individual word, or that make up special, just really, it's more linguistic to a compound word.
Yeah, no, that's great. Thank you. That's a really great reminder and overview. So there's lots to talk about today. I think the first thing that I wanted to bring up is, Joe and Cat Chats started as, a call or a chat to talk about racism and systemic racism, systemic oppression. And one thing that happened fairly recently, it was just over a month ago, was there was an Indigenous woman that died in hospital in Quebec here in Canada. Her name was Joyce Echaquan. A video, I guess, surfaced of her being insulted by the medical care professionals while she was in hospital, and they were racist insults. And I think that I wanted to discuss this in particular today because we are going to talk about healthcare, and we're going to talk about it in sort of this macro way, like there's policies involved, and I just don't want people to forget that there are, you know, these micro interactions that happen that perpetuate systemic oppression and systemic racism within these systems that we're talking about. Yeah, so I think when we talk about things like when you open this chat with your mask on, it says defund the police, get rid of them, but we can't do that without addressing systemic oppression in all the other places, the institutions. Yeah, and exactly, stop killing Black people. This happens in hospital too, because of neglect, basically, because of the racism that is ingrained in all of us, and it's a
Absolutely.
systemic issue. So
Absolutely. And there is a specific terminology for that, Miss Wells, and I think I might have mentioned that in episode 5, when you talk about this sort of history of Black people receiving poor quality or lower quality treatment, or quite honestly, being treated as experiments to further advance medical science. That is called medical apartheid.
yeah,
Medical
absolutely.
apartheid. And there's one example of medical apartheid is the Tuskegee effect.
Yeah.
And I know we mentioned this on episode 5, not to belabor the point, but the Tuskegee effect came from the Tuskegee Airmen, when a bunch of airmen in Tuskegee, Alabama were unknowingly administered the syphilis virus,
Yeah.
and then were studied for long term. And then they didn't know they had the syphilis virus, and they all died. And historically speaking, the Tuskegee effect is when it is a distrust by Black people going to the doctor, most specifically white doctors.
Mm-hmm.
Because look at what happened with the Tuskegee Airmen. It was a bunch of white guys that infected a bunch of Black airmen.
Yeah.
And look what happened to the airmen. They all died. And the medical professionals violated their Hippocratic oath of to do no harm. And they harmed them and didn't inform them of the dangers of having syphilis. Shameful.
Yeah.
Shameful.
It's disgusting.
And disgusting.
Yeah.
And disgusting.
Yeah.
And disgusting.
And yeah, this happens in Canada too. I mean, it inflicts or impacts Indigenous folks a lot because of the lack of access. And there is sort of I don't know if I would call it a program, but there is, I guess, a process in place where oftentimes, because a lot of Indigenous communities are in very remote areas, they don't have access to a doctor all the time.
Sure.
And so there are doctors that fly into these areas to provide care for, like, you know, a certain number of days a month or a year.
Right.
And you know, there is often a large mistrust of those doctors because they're, you know, flying in, whatever race they are, they're coming from this colonial, you know, medical system that they may or may not trust. And, you know, the access issue is another problem. And, you know, the racism is just embedded in all of that too.
Absolutely.
Yeah, so yeah, so I guess moving on from that, of course, keep that in mind and definitely check out the last episode we had on healthcare. But today we wanted to also just bring it into sort of a policy conversation. So we're talking about the Affordable Care Act and what that is, what it entails, and why it's actually under threat right now.
Why it's under threat. Okay. We're going to dig into this because a lot of people don't actually know what the Affordable Care Act is or how it functions or what it does. And the Affordable Care Act is a massive piece of legislation. And it became law on March 23, 2010. Let me say it again. It became law on March 23, 2010. The Affordable Care Act, it's something like, it's about 900 pages long. There's a lot of stuff in it. Now, the Affordable Care Act it was actually loosely, I shouldn't even say loosely based. It basically came from Mitt Romney. When Mitt Romney was governor of Massachusetts, Mitt Romney, the people of Massachusetts residents said, hey, Governor Romney, we need a healthcare plan because healthcare costs are out of control. So Mitt Romney goes to a right-wing think tank called the Heritage Foundation and says, hey, Heritage Foundation, I need you all to come up with some sort of healthcare plan for my state. So the Heritage Foundation, they ordered some food. They sat around the table at their offices. They had a couple of beers at the bar, wrote some notes down on some napkins. And they came back with what's called a three-legged stool model of healthcare. Now, the three legs of the stool are the three pillars, as you might see in some healthcare literature: government subsidies, access to insurance, and a fancy rule called the individual mandate. Now, if you're taking notes, don't worry about the government subsidies and don't really pay attention that much to the access to the insurance. Okay, what we're going to really focus on is the individual mandate, because the individual mandate is really going to be a major focus of this conversation as we continue on, because that is the linchpin of what potentially could come down and could be catastrophic for the future of healthcare in the United States. Now, government subsidies happen because of premiums and the amount of salary that you make. The access to insurance comes through what's called the Medicaid expansion. And in episode 5, I spent quite a bit of time discussing what the Medicaid expansion actually is. If you want to go ahead and review what it is, that's fine. But and all the different limits, 100%, 138%, the federal poverty limit. There's we could spend the next 30 minutes talking about that, but we're not going to do that because there's more pressing issues that we have here. But essentially, when the Medicaid expansion came out, 36 states said yes, 36 states plus Washington, D.C. said, yep, we'll take the money from the federal government. The federal government ended up paying 90% of all related medical costs to the state. So all the state had to do was come up with 10% of the money. 14 states, including the state that I live in right now, North Carolina, said, we don't want to take we don't want to take money. So imagine if someone said to you, Catherine, hey, would you like a loonie? And all you have to do is just take it. And then all you have to do is come up with the extra or how about this? Someone said, okay, hey, look, there's $1 out here, but we'll give you 90 cents of that dollar up front. All you have to do is come up with the other 10 cents on your own so you could get a loonie. Who wouldn't take that deal? Who wouldn't take that deal?
I am, surprised that anyone didn't.
But 14 states ended up saying, you know what? Nah, we don't want 90% of our healthcare bills being taken care of by the government. We don't want that. So that's what happened. And the voting for the Affordable Care Act was essentially down party lines. I think it was 52 to 48. And since the ratification of the Affordable Care Act, which is now a little more than 10 years old, Republicans have tried to overturn the ACA at least 70 times.
Ooh.
And I'm going to say that again. Republicans have tried to overturn the Patient Protection and Affordable Care Act at least 70 times. 70 times. Okay? Now, what we're going to talk about next is an important rule. It's an important rule, and it's really going to be the foundation of what this conversation is truly about. Again, we talked about the 3 pillars or the 3 legs of the stool that make up the Patient Protection and Affordable Care Act, otherwise pejoratively known as Obamacare. Because when Mitt Romney had MassCare in Massachusetts, everybody called it Romney Care because people didn't like it, but a whole lot of people signed up for it. Now, the individual mandate, as I said earlier, is a fancy rule where you, private citizen, have to buy a privately owned product. This privately owned product is health insurance, and you have to buy it from corporations. That's what it is. Now, if you, private citizen, don't buy that privately owned product, we, the public, in this instance, the government, most specifically the Internal Revenue Service, will assess a penalty to you for not buying that privately owned product. The penalty for an individual was $695. The penalty for a family was a $2,000 penalty. So, single brother like me, If I didn't buy health insurance back in the day, I had to pay a fine of $695. Let's say I was married with a daughter and we were like, you know what, nah, we're not buying health insurance. We owe $2,000. That happened.
Wow.
So that's the individual mandate.
Mm-hmm.
Now, a whole lot of people weren't necessarily up in arms and screaming about this because health insurance is such an intangible, and it's insurance. When you need insurance, it's there. But you don't wake up in the morning and say, you know what, I'm going to make some tea and think about my insurance. No one actually does that. But if you sprain an ankle, at least in the United States, you're like, yo, do I have health insurance to get a splint on my ankle and get the medication I need so I can lay up for 4 weeks so my high ankle sprain can get better?
Mm-hmm.
That's when health insurance actually comes to the forefront of your mind. It actually becomes a tangible, because what you pay for is health care, but the actual mechanism to get health care is health insurance. So if this were a phone, okay, a phone, and let's say the federal government ordered everybody to buy a phone. Let's say you, Ms. Wells, you're like, you know what? I don't want a phone. All my friends and family are here, and everybody I really, really want to communicate with, I can just knock on their door or go down the street, or I can just send them an email. I don't need a phone. And plus, all this social media business, I don't really like any of that. And let's say the government said, oh, Ms. Wells, you don't want to buy a phone? Doesn't matter what kind of phone you buy, whether it's an iPhone or an Android, you are buying a phone. And you're like, nope, not buying a phone. Government says, you know what, you're on the hook for $695. Imagine how batshit crazy people would be in the streets if that were actually a thing 10 years ago. If the government forced everybody to buy phones, and if you refused to buy a phone, you were assessed a penalty for not buying a phone.
Mm-hmm.
Every major street in every major city in the United States would have people marching up and down the street saying, no way. You would have signs like this saying, I don't want to buy a phone, or something along those lines. But nobody did that. Why? Because you can see a phone, you can't see health insurance. So people weren't screaming up and down and up in arms about it.
Yeah.
So that's what the individual mandate is. So when President Trump passed the Trump tax cuts of 2017, it's actually called the Tax Cuts and Jobs Act of 2017. Inculcated in this legislation was a $0 individual mandate penalty. Because one of President Trump's campaign promises was to repeal and replace Obamacare.
Mm-hmm.
But if you remember the other two parts of this, the other two parts are government subsidies and access to insurance. Access to insurance came through the Medicaid expansion, and the Medicaid expansion said, okay, hey, we, the government, we're going to give states a bunch of money to take care of health-related issues. That bunch of money that the states received are what's called block grants. Mm-hmm. So, hey, here's a bunch of money, and all you got to do is come up with 10%, and there's a whole lot of people that have health care. Now, how it actually works mechanically is another conversation. You can watch episode 5 to learn more about that. And then government subsidies is just, hey, you know what? You make a certain amount of money based upon a sliding scale. The federal government will have a certain amount of government assistance to help you afford to buy health insurance through what's called these state exchanges. So President Trump knew that he couldn't sue anybody to get rid of government subsidies. Just like, can't really do that. And the access to insurance, that would be through the Medicaid expansion, and that would just take forever. And you would probably have to sue each state that accepted the Medicaid expansion. And then you would have a bunch of lawyers going back and forth to the Supreme Court. Nope, too expensive, too time consuming. So President Trump said, you know what? I know it's a 3-legged stool model, and I need all 3 legs for this law to be useful. If I can weaken one of the legs, this whole law is almost dead on arrival. So what did he do? He knew he couldn't do anything legislatively in terms of trying to sue somebody or whatever to get rid of the individual mandate. So he said, okay, you know what? I'll just reduce the penalty to $0.
Mm-hmm.
So if you or a single brother like myself, and you're like, I don't want to buy insurance, I don't have to pay a penalty for not buying insurance. So there's no more $695 penalty. Now, part of the reason insurance works so well is because insurance shares the risk. So the more
Yeah.
people you have paying into the pool of money that is the allocated amount of premiums to cover risks or losses, you end up with lower premiums because you're sharing the risk among the population that decided to pay into the system. So when you have fewer people being forced to pay into the system,
Mm-hmm.
insurance companies have to raise their premiums to cover their costs. So one of the consequences of the $0 individual mandate is what's called junk insurance. Insurance companies knew that they weren't going to get their free cash cow anymore because they weren't going to get premiums from everybody that had to buy insurance.
Yeah.
So what they said was, okay, you know what? We're not even going to jack up your rates. We're going to offer less benefits and services to you. And we're going to increase your deductible. So what you ended up happening with this Trump tax cut of 2017 is insurance rates increased, deductibles increased, and the amount of coverage that you received was lower.
Mm-hmm. Making it less appealing to want to get the insurance anyway. Therefore,
That's
crumbling the three-pillar stool.
completely
Ugh.
collapsing it. On top of completely collapsing it's basically on life support right now as it is.
Yeah.
So when you have the actuarial science of health insurance would dictate that people who are most likely to use health insurance are older people
Mm-hmm.
up until the age of 65 and sick people.
Yeah.
So if you are in your mid to late 50s with a chronic condition, your health insurance premiums are through the roof.
Yeah.
Because you're not only old, but you're old until the point you can actually get Medicare, which is government funded, what's called a
Mm-hmm.
single payer healthcare system, single payer system. But
Yeah.
you also you're a higher risk because you have a chronic condition or maybe even a pre-existing condition, which means you're going to need more medical services, which means you will be using the healthcare system more than somebody who is healthy, doesn't have any illnesses or pre-existing conditions.
Mm-hmm.
So if you're more likely to use the system, the amount of premium that is required to cover the usage need to be proportional. So older, sick people ended up getting higher premiums because of the $0 individual mandate. And because there were fewer people paying into the system, if you were a young, healthy person that wanted to buy health insurance, your premium increased to cover the lost premiums from people who refused to buy health insurance because it was no longer required.
Mm-hmm. Oh my goodness. Okay. That's a lot. And it totally just puts it into perspective and clarifies sort of the reason why these policies that the Trump administration implemented are just like basically a way for them to get rid of this Affordable Care Act.
Correct.
What I also find interesting about this is, so you said that it was sort of prompted by Mitt Romney and that institution.
The Heritage Foundation.
Yes, thank you.
You're welcome.
And were they not Republican?
The Heritage Foundation? Yeah, I said. I
Yeah.
think I might have mentioned that earlier. They're a right-wing think tank.
Yeah. So I find it really interesting that this has sort of been created by a right-wing foundation and politician, implemented by a quote unquote left wing one, being Obama, because it's sometimes called Obamacare.
Correct.
Yet the Republicans, you said, tried to strike this down
At
70
least
times.
70 times.
At
Absolutely.
least.
At least 70 times. And I'm happy you mentioned that, Catherine. And that's obvious. You're one of the smartest people I know, so I'm not necessarily surprised that you picked up on that. The other part of all of this is, let's say Mitt Romney had been elected president back in 2008. care to guess what healthcare plan America would probably have had? The
The exact
same,
same one.
the exact same one.
Yeah.
The only difference is the branding of the healthcare system, the
Yeah.
name. It wouldn't have been, it would have probably still been the Patient Protection and Affordable Care Act, but it would have been Romney Care instead of Obamacare.
Yeah.
So just to make sure that everybody understands this, a Democratic president in Barack Hussein Obama gave America a Republican healthcare plan. And Republicans in the House and Senate tried to repeal that healthcare plan at least 70 times.
That's so interesting to me because of, like it just demonstrates the, I guess just the radical sort of polarization that the politics everywhere. I mean, it's not exclusive to the USA, but it's just demonstrates how the branding and the sort of polarized, left versus right thing that happens is so ingrained. And I bet you lots of people didn't know that. I didn't know that about the ACA, and so yeah, I find it really interesting, and especially because we're going to talk about how I mean, there's a forthcoming thing. I don't know. I guess a case is what you
Supreme
call it
Court case.
for the
Supreme
Supreme
Court
Court.
case.
Yeah, exactly. That is upcoming next week when this episode comes out. It's going to start, and it's the California versus Texas case.
Absolutely.
So it's on the chopping block again. And that's, yeah, I think it's really interesting to know sort of the history and how this was implemented, what the process was, and why, or I guess how and why it's being dismantled.
Mm-hmm. Yeah, and we should probably talk about this case because this is really why we decided to do the update on this healthcare. Is this upcoming Supreme Court case on, and the oral arguments will begin on November 10, 2020.
Yeah.
November 10, 2020, or as I like to say when I say my dates, November 10, 2020.
Yeah, so that should be the day that this episode comes out, which is wild.
It will be the day that episode comes out. Yes, absolutely. And we might even try to release it early in the morning. Yeah. That way everybody kind of has an idea of what to know and what to understand. That way when people start talking about all this stuff, if you want to watch it on C-SPAN, you're like, oh, you know what? That Sister Kat talked about that on Joe and Kat Chats. Or that brother Joe did mention the individual mandate. And now I know what these brothers and these cats and these white guys and white girls in the Supreme Court are talking about. It all makes sense now. It all makes sense. But let's talk about California versus Texas. Now, I think it was the attorney, it was either the governor of Texas, Greg Abbott, or the attorney general of Texas said, you know what? This individual mandate's unconstitutional for the reasons that I mentioned earlier about the phone. You can't have the government forcing people to buy a product they don't want. Oh, that's unconstitutional. So 20 states plus Texas said, you know what? We're suing other states that support the ACA. So California was like, you know what? We like the Affordable Care Act. It works pretty well here in California. We're able to make sure a lot of people get their health care. Plus, we're one of the states that took that giant chunk of money from the federal government so more people could get access to health care. As again, one of the three pillars of the Affordable Care Act is access to insurance. The access to insurance was provided through the Medicaid expansion. Right, the Medicaid expansion. I always mix them up because it's easy to mix up. So, oral arguments for the striking down of the Affordable Care Act are going to take place next week. There's a lot at stake here, a whole lot at stake here, because abortion rights could be on the chopping block. Okay, Medicare enrollees and free choice of provider could be on the chopping block. Medicaid work requirements. So if you are Medicaid and you have to provide eligibility for meeting work and reporting requirements, if you don't meet those requirements, you could lose your health care. This happened in Arkansas. 18,000 people in Arkansas lost their health care because of this. There could be discrimination in health care coverage and care there's certain provisions in the ACA that ban discrimination for certain types of health programs and certain types of health that are related to religious freedoms. So
Mm-hmm.
that could be on the chopping block. We talked about immigration and we talked about refugees. Another potential problem with the striking down the Affordable Care Act is what's called the public charge rule. Now, if you're an immigrant and you are likely to use a public program, the government could prevent certain immigrants and refugees from getting a green card. So you're probably like, okay, well,
Wow.
what's the problem with that? Here's the problem with that. If people want a green card because that's the path to getting a work permit, it's also the path to citizenship. So if you know that the government is watching how often you might be using public services like Medicaid, the participation for immigrant families and their US born children will decrease, which
Yeah.
could potentially mean health issues for these populations as a result of them not using basically government funded healthcare. Now, think about how harmful that could be, especially in a pandemic.
Oh my gosh. And these are already vulnerable populations in the first place.
Absolutely.
So yeah, the implications of that is vast, just vast. These are also people that tend toward, really precarious employment opportunities because of their status.
Absolutely.
And yeah, I mean, there's so many ways. Like you just listed a whole bunch of ways that this this act, this Affordable Care Act, is sort of an umbrella thing that has all of these trickle down, implications that are
Mm-hmm.
really, really important for a lot of people. And I
So,
mean,
yep.
my goodness, like that is, you just covered like a vast amount of people that would be impacted directly by this being overturned.
Oh, and Ms. Wells, that's only part of it. That's
Yeah.
only part of it. Let's not forget, if you strike down the ACA, and part of the reason why the ACA had some benefit was to reduce the amount of premium costs, and it
Right.
also covered pre-existing conditions. If you get rid of the ACA, people with pre-existing conditions, you're not covered anymore.
Yeah.
Goodbye. And
Again,
so,
another vulnerable population because they already have pre-existing conditions. And that should,
exactly.
like, I in my mind, probably because I grew up with universal healthcare system, I'm like, why would that ever, prevent, it should never prevent someone from getting care, but it
Mhm.
does because you have to pay for it if you don't have insurance, and
Exactly.
you would not want to do that because it's so expensive.
Exactly. And if you're on a limited income, are you going to pay a $500 or $600 monthly premium for health insurance, or are you going to pay rent?
Exactly. Yeah. Yeah.
You know, all the health insurances in the world isn't going to keep a roof over your head or put food on the table.
No.
So people have to make that decision on a day-to-day basis.
Yeah.
And and part of the reason why the Medicaid expansion is such a strange rule is because you could have the government covering chronic conditions, chronic medical conditions in a particular state. I used to live in Maryland. Maryland was one of the states that accepted the Medicaid expansion. I now live in North Carolina. This state didn't. So let's say I had a chronic medical condition. Let's say I had a kidney issue that required dialysis 4 days a week, every other day. If I lived in Maryland, I could get that taken care of by the government because they're the state that accepts the Medicaid expansion and they can cover my medical bill, my kidney dialysis treatments. Let's say I move here. Now what? Now I got to pay for dialysis. So instead of getting dialysis 4 days a week, I might get it twice a month.
Mm.
Okay.
Yeah.
Think about the long-term ramifications of getting kidney dialysis twice a month. That can lead to sepsis, I could have diseased blood. It could lead to renal failure, which means my kidneys could shut down. And then think about how expensive a kidney transplant is. Now, if I couldn't afford my health insurance in a state that didn't the Medicaid expansion. What makes you think I'm going to be able to afford a couple of kidneys?
Yeah, exactly.
With what? With what money? I can barely afford the $700 a month health insurance premiums. What makes you think I'm
Hmm.
going to be able to afford a $250,000 surgery?
Exactly.
Good luck. Thanks for
Yeah.
good luck.
Yeah, another example of this that was mentioned in one of the articles I read today was, coal miners. I mean, under the Affordable Care Act, a lot of the people who are now sick because of black lung, which is
Yep,
a thing that happens to pretty much all coal miners. It's been,
absolutely.
documented, and it's just a thing that happens. It's a dangerous job, and people still do it. But you're covered at least. You're maybe retired and you can't work anymore because of this condition. You're covered under the ACA, but this is going to put it at risk. That puts a lot
Well,
of people who are in vulnerable positions at risk if this gets
absolutely.
overturned.
Absolutely. A lot of people. And in addition to the people we just mentioned, there's already, again, the Affordable Care Act. If I want everybody to make sure of what I said, I didn't say that everybody was getting health care. One of the
No.
pillars was access to insurance. So if you don't actually have the particular mechanisms to obtain access to insurance, guess what? You don't get insurance. So there are still, depending on what numbers you're willing to believe, there's approximately 28 million people pre-pandemic that did not have health insurance in the United States.
Yeah.
20 million. Now, in the United States, health insurance is tied to your job. Look how many people have lost their jobs since the middle of March.
Yes.
And if you've lost your job, you've lost your health insurance. Now, if you have a family insurance, if you have a family of five, and let's say the wife is the one that who has the health insurance, and the husband and three kids are on that health insurance policy, wife loses her job because of the COVID-19 pandemic. Guess what? Five people just lost their health insurance. So it's not as easy as just saying, okay, yep, there have been 59 million jobs lost as a result of this pandemic. Okay, 59 million jobs lost as a result of the pandemic is one statistic, but that doesn't mean it's 59 million people that are without health insurance. It's probably way more than
Way
59 million
more.
people that have lost health insurance.
Yeah.
So
Yeah.
if this law gets struck down, according to various estimates, an additional 20 million people will lose their health insurance. 20 million people. That's on top of the already 27 million people that already didn't have health insurance because of the way the Affordable Care Act was constructed, and all the other millions and millions of people that have lost their health insurance as a result of this pandemic.
That's more than the population of Canada.
The amount of
It's a full.
uninsured people alone, not people who've lost their jobs because of the pandemic, but the 27 million and then it's estimated 20 million,
Mhm.
that's about 6 or 7 more million people than Canada has as the entire country.
Yeah. Yeah, which is so
That's a
mind-boggling
damn
to
shame.
really grasp. It's such a shame. Yeah, my goodness. It's heartbreaking, really. Oh, yeah, that's a lot. One other thing that I wanted to mention in today's chat, regarding Canada particularly, is recently Alberta has a new bill that aims to have 30% of surgeries performed privately.
Mm.
So what that means is, I mean, we have a universal healthcare system, which we can talk about what that means as well. But they're shifting, it's basically a way to start shifting the healthcare system to a privatized one, or at least have a tandem privatized one. So
Okay.
there are major implications to this. For profit usually costs more for the surgeries,
Makes sense.
which the province would compensate for, which means the taxpayers would just be paying more for these privatized surgeries,
Mm.
at least as they implement them. Of course, if you're rich, you can pay for it yourself and get care quicker and whatever quicker and it'll cost more, basically.
Sure.
But I mean, there are tons of studies proving that the care is usually lower in these for-profit places that do healthcare, because
Yep.
it's based around a system that benefits from cutting costs. It's that's what capitalism, the capitalist system, requires.
Absolutely.
So, they're cutting costs in order to make more profit. So your health is at stake, basically. And it puts the sickest people more at risk because they have to wait for public systems to take them, because the private systems usually want to take the people that are less sick and just get as many surgeries out as they can, or perform as many as they can for profit.
Right.
So I think the point here is really that we in Canada, I think, take advantage of the fact that we have a universal healthcare system.
Correct.
And this is not a unique circumstance. There are bills in Saskatchewan and BC, for sure, that are also proposing various ways of doing sort of a more privatized healthcare system. So when we're talking about, every vote counts, we're talking about policy changes, we're talking about legislation that is, in the Supreme Court right now. That doesn't mean that, Canada's excluded from this. We have to fight to protect the healthcare system here.
Correct.
And that's something I think people don't really realize, in the day-to-day. And like you say, you don't really think about this stuff, but this I guess, I don't know, it's like a social policy. Like, this is at stake in a lot of places, and the right wing leaders of these provinces are swinging towards, a privatized system, which we know doesn't work. I mean, look at Flint, Michigan, for example. Like, they privatized the water system, and guess what happened?
Yep.
Lead poisoning.
Lead poisoning. Lead poisoning. Lead poisoning. There's a lot to be said, especially with everything that Tommy Douglas did to make sure that Canadians have health care, make sure everybody has health care. It seems that now more than ever, healthcare companies are more focused on profits rather than actually caring for people. We've certainly seen that in the United States, and it's a shame to see and hear that Canada is adopting these sorts of avaricious and rapacious practices.
Yeah, it's something that I think a lot of people don't realize, and it needs to be at the forefront of our minds, especially as those of us who are sort of active in social movements and activism. Like, we need to care about this stuff because we advocate for vulnerable people all the time. But if we're not advocating for healthcare, then there will be no people to advocate for, because the vulnerable people go first. And that's just how it is. And it's awful to say that, but
it's awful, but it's necessary.
Yeah.
It's awful, but it's necessary, because if we don't have health care, there won't be any vulnerable people to stand up for.
Yeah.
And maybe that's the grand plan by these oligarchs, is to make sure that they systematically commit, I guess, certain types of genocide that don't necessarily look like genocide or the typical connotations of the word. So if you cut off healthcare access to certain vulnerable populations, populations that people need to have other people support them, and if you systematically deny them healthcare so they eventually die, then maybe that's their plan. I don't know, but we can't have that happen, because healthcare is a human right, and everybody deserves the right to be healthy.
Yeah, I disagree that it's a plan, because there's more at play there. It's very complex.
Okay, fair enough.
But yeah, you're right. I mean, everyone deserves care. Everyone deserves, to be as healthy as they can be, and denying healthcare is one way to really just destroy a population.
Yeah.
Yeah.
It is. And the Supreme Court is, I know we haven't talked about this, but it's important to bring up this part of the discussion to everything we're talking about now, because a little more than about 6 or 7 weeks ago, Ruth Bader Ginsburg died.
Yeah.
And within 30 days, the Republicans appointed Amy Coney Barrett to the Supreme Court. And she is a super hardcore right-wing conservative Supreme Court justice.
Yeah.
Now, the Supreme Court of the United States has 9 members. 6 of them are conservative, 3 of them are liberal. Now, as I said about maybe 15 or 20 minutes ago with regards to the ratification of the Affordable Care Act, the Affordable Care Act was voted on essentially down party lines. I think the score was 52 to 48. And I shouldn't even say score, but the voting tally was 52 Democrat, 48 Republican. Now, the Supreme Court are going to listen to arguments to see if they're going to keep this law or strike it down and create even more turmoil in the United States. Now, a lot of people thought that Amy Coney Barrett's appointment was to help Trump become president if there was a potential court case or controversy with the election. And that might be true. But I think the other reason why Amy Coney Barrett was appointed to the Supreme Court was to ensure that this law gets struck down. Yeah. Because her voting record and many of the cases that she tried, again, she's a hardcore conservative, and she is, I'm fairly certain through a couple of different interviews and what I've read about her, she vehemently opposes the Patient Protection and Affordable Care Act. So she'll go ahead and listen to arguments. But I would certainly think that if she feels that the individual mandate is unconstitutional and other conservative justices think it's unconstitutional, I'm going to find it very difficult to think that 2 Supreme Court justices of the 6 that are conservative will go over to the liberal side of the Supreme Court and rule and say that the individual mandate is unconstitutional. Now, as well as I'm not a lawyer, nor am I going to pretend to be a lawyer. I'm just a guy that has a couple of master's degrees and a little bit of common sense, and I have the innate ability to read the tea leaves when I see them brewing in the pot. Again, if you have a conservative justice that was appointed to the Supreme Court, surrounded by other Supreme Court justices that are majoritarily conservative, and a Republican governor from a red state said, you know what, this is unconstitutional. And a Republican president came out and said, you know what, I want to repeal and replace Obamacare, and then essentially took a hacksaw to one of the legs of this 3-legged stool model of healthcare by reducing the individual mandate penalty to 0. What chance do you think the Affordable Care Act is going to be around by Thanksgiving or Christmas, for that matter?
Yeah, and that's exactly why we're speaking about this today. It's something that I think everyone should be paying attention to, and it's convoluted and complicated, and that's why we wanted to sort of go through it all and make it into something that's a little bit easier to understand, so that when we're going into this court case, we understand not just the court case itself, but the implications of getting rid of the ACA.
Yeah.
It's going to be vast and a very, very prolonged, I guess, timeline of how people are going to be impacted through time. I feel like that was a silly way to say, like,
it wasn't a silly way to say. I understood what you were going. I understood what you're saying. Yeah. I mean, there's a lot that's going to take place with regards to either the Supreme Court upholding the Affordable Care Act, or the Supreme Court saying, you know what, this is strike it down. We're going to strike this down in full. It's done. Start over.
Right.
And given the way the elections are going right now, the Republicans have maintained control of the Senate,
mm-hmm.
and the House Democrats have lost more seats in the Senate, in the House, to the Republican Party. Now, we don't know what the presidential election is going to look like. Votes are still being counted. That's why the sign, count your vote, because it's important to make sure that every vote gets counted.
Yeah.
I'm not sure how much will actually get done with a new type of healthcare law with a Democratic president a Republican controlled Senate and a Democratic House.
Right, exactly. So no matter the outcome of the presidency, like this is really at risk, and it seems like it's probably going to be struck down. And so yeah, so it's going to take a lot to even bring any new medical healthcare package, whatever, like bill, whatever. It's going to take a lot of time and effort, and I agree. It's just there's no way that this is going to be something that's implemented over the next 4 years, no matter who the president is.
I don't see it happening, considering it took so long to get the Patient Protection and Affordable Care Act into place.
Yeah.
And that took the better part of almost 2 years of going back and forth so everybody can eventually agree on something. And the Republicans still ended up saying, we don't like any of this.
Yeah, 70 plus times.
And
My
then
goodness.
at least 70 times they tried to strike down the law. So part of the phrase, but by November 10th, for a lot of Republicans, it's a Republican's wet dream at this point. This is the day that everybody's been waiting for. It's like, you know what? Finally, we will get rid of this law. We will get rid of this law because of, I guess, not only because of and again, I don't like the fact that the government is forcing people to buy a privately owned product. I think that's ridiculous. But at the same time, there needs to be some sort of government health care. So
Yeah.
not to get too deep into the weeds with the policy, but of all the things that Trump has done that have been absolutely terrible, there's a part of me that agrees with him saying, you know what, this individual mandate, this is whack. Let's get rid of this. I agree with that. But he didn't put anything in place to deal with the consequences of reducing that penalty to $0. That I have a problem with. So when
Yeah.
a huge problem, as we've outlined over for the past 15 minutes or so. So when the president says, you know what, I'm going to repeal and replace Obamacare. If you're going to replace it with something like Medicare for all.
Mm-hmm.
Replace it with Medicare for all, or replace it with a universal healthcare system.
Yeah.
Or a single payer healthcare system like Medicare for all. If you're not talking Medicare for all or universal healthcare, then leave the ACA the way it is.
Yeah.
Plain and simple.
Yeah,
Because
I mean, no system is perfect, but there are systems that actually help to take care of your citizens, and it's clear that they don't want to do that. They want to reinforce vulnerability and precarity within the population.
Yep, that's it. That's
Yeah.
it. Yeah. And I know we're getting short on time.
Mm-hmm.
I know I still have that DJing timing, even though I haven't picked up a pair of turntables or played a few records in a bunch of months. But again, I want to make sure that everybody understands that healthcare is a human right. Everyone has the right to be healthy. And this court case that's coming on Tuesday, November 10, it's important. It's going to be one of the most important court cases of my lifetime. And I have a daughter that's 9. She'll turn 10 years old at the end of this month. And it's going to affect her health.
Yeah.
Because if abortion is going to be on the bill, if abortion hangs in the balance, that's an issue. And the Supreme Court going 6-3 conservative, reproductive rights are going to be on the bill. And reproductive rights are part of healthcare. And reproductive rights, we talked about this in last week's episode of Maslow's hierarchy of needs. It's the lowest level need. It's right there with air, water, and shelter and food.
Exactly. Yeah, the long-term implications are really what we need to be concerned about. And yeah, I mean, we have to
There's a
just
physiological need.
Yeah, thank you. But yeah, no, I totally agree with you. And I think that we need to just take this moment to really think about the implications, but also don't let that, I don't know, make you just sad. Like this has to be a moment where we rise up and we work on stuff together, because that's what this chat is about, the Joe and Kat chats. That's what this year for me has been about. We have to start doing something about all of the bullshit in the world.
That's why I was in the streets today. I know there's a few more marches and protests taking place this weekend. There's another one of these vote marches taking place in Raleigh, North Carolina, I think on Saturday. I've got my daughter this weekend. I might even see if there are a bunch of little kids out there at the march today, walking alongside their moms and dads and uncles and aunts and nieces and aunts and uncles. Might take Parker, put her on my shoulders, and
That's
we might
great.
walk a bunch of blocks around so she sees what activism actually looks like.
Good. And oh
It's
my gosh,
important.
we're out of time, Joe, but
Not a problem.
thank you so much
That's
for
all.
yet again so much knowledge. We have to
That's
go,
what we're here
but
for. All right.